Nigeria in many hospitals where it is noteworthy that there is no single death in those hospitals. It's all because of his new approach in nutrition and healthcare approach. So I'm very happy to invite Dr. Eapen Koshy to make his presentation. Please, Koshy, come in.
Good evening, everybody. Dr. Saji, thank you very much. It's a pleasure to see you and to listen to you. Benji, am I audible?
Yes, yes, yes.
Yes, yes, yes. I will start off. I will actually tell you why I got involved in alkalinity so much and how I had a personal journey. I will say that in 2 minutes. And then I will share with you for about 12 to 15 minutes about the current scenario and the role of our alkaline superfoods in DXN in our current scenario. After that, we will set time for questions and we will take it on from there. Yeah, it was actually 8 years ago when I was already had given up a lot of acidic foods in my life, predominantly sugar and meat, but not yet given up milk. But I was also a marathon runner, doing a lot of running almost every month. When I was in Chennai, all over India, I used to go and do marathons. But I was facing a big problem in my life. After every run, I used to get a swelling of my right heel. It was an inflammatory swelling. And I had gone to my own friends, eminent friends in orthopedics. I had taken steroid injections, but it was of no avail. And this was depressing me a lot because I knew that I will have to stop running soon. So it was by coincidence that I was introduced to DXN and I started consuming spirulina and ganoderma. Within 3 months of this consumption, a lot of changes started happening in my body. First of all, my marathon timings started improving. So much so, I was beating my own timings of when I was 20 years old. Okay, it is really a miracle-like thing that was happening. And then over 3 to 4 months, I found my swelling to completely resolve by itself. And after a run now, even now, I can run as much as I want and the swelling never comes back. And so I started experimenting on myself. I started taking high doses of spirulina and ganoderma, and I found out that there was no swelling at all in my body. My GI inflammatory, sometimes you get an irritable bowel syndrome, a loose stool-like thing in the mornings. All that disappeared, and I also realized I had no smell in my mouth. My entire GI bacteria was changing and coming to where it should normally be. I shall talk about this in the next few minutes. And I realized I was not needing to brush my teeth. My marathon running was almost every week, and all these made me start thinking. And then after 6 months, I started giving this to patients, and I found the same results in each and every one of them. And in the last 8 years, I'm so confident that I can share a lot of avenues for you. And I know that this alkalinization and these superfoods are the answer for all ailments, that happen. With this personal experience, I will start my talk today. Shall I start, Benjamin? Benji? Yeah.
Yes, doctor, you can start.
Yeah, I can start. Yeah.
Thank you. Thank you.
Yeah. Since this is a very closed meeting amongst ourselves, I can speak the truth without any. When I speak to newspaper reporters, when I give big interviews, you cannot tell everything that is in your mind because you will be misunderstood. You'll be misunderstood. But today I can speak the truth. Yeah. The first point, Saji, I want to share with everyone is there is nothing called disease. There is no disease state. Everything is man-made. It is because of negative nutrition, a negative lifestyle, and the unnecessary use of chemicals that all disease states today we are seeing. Okay, as a doctor or as a learned person, one just has to find out what is the negative nutrition that the person is taking, and what is the negative lifestyle that is doing. Correct that, and the disease, that is the foundation of getting you back to normalcy. Okay, there is no need for chemicals in any situation. Our body is dynamically and so wonderfully and so fearfully created, and it is a pity that we resort to chemicals. And I tell you today, the chemicals are the reason why we are having this pandemic here today. For example, let me take the commonest lifestyle disease and the commonest disease that is succumbing to COVID now. It is diabetes. Diabetes is just a state of body lethargy, okay, and body acidity. I'm talking of the acidic balance pH of the body. It is because of negative nutrition and negative lifestyle. You correct these both, give alkaline superfoods, correct the lethargy, you can come out of chemicals. With chemicals, nobody can come out of diabetes. You go deeper and deeper. Can you show me a single person who has come out of diabetes with chemical drugs? It does not exist. But in the world of naturopathy and in herbal, there are hundreds and hundreds. That is what is happening. But everybody is having a closed mind. Nobody's eye is opening. Okay. Now, in diabetes, the body is lethargic. This lethargy is also there for the immune system. And that is why there is an inflammatory response to the COVID. Even just now, I had a call from Dubai. Somebody who is a diabetic is suddenly COVID positive, is very lethargic, and the fever is very high. The doctors are giving him antibiotics like erythromycin, but they got my number and have contacted me. So I said, please don't take the erythromycin now. It will not kill the virus. It has got nothing to do with the virus. It will actually make him more downgrade the body. Just give him turmeric water, give him 5 spirulina, and if you have reishi powder, I will arrange it for you in Dubai. Please take it now. And I hope this happened 10 minutes ago. Okay, because if you go on to an antibiotic stay, take antibiotics, it will only downgrade the body further, and every paracetamol that he takes unnecessarily will make the body more acidic and will actually make him succumb to the COVID. This is what is happening all around the world now, and there is nothing we can do about it. And so I'm saying a few things now before I put on a nutrition chart. Okay, most of modern medicine will die soon because there is no answer in chemicals. Okay, which is so evident now, but the world has yet to open their eyes. There is a huge error of judgment that is going on at the moment, at this current state. 100 years from now, this era of ours will be called as an idiot era of chemicals, a stupid era of chemicals which brought on pandemics. Okay, that is what, because more pandemic has to come, more viruses will come, could be variants, could be others, as long as our immunity is downgraded by chemicals and by many other factors in lifestyle. Okay, with that I will go on to a few things. I made a statement saying there is nothing called disease, and everything is man-made. Yeah, everything is man-made, and everything is reversible, not with chemicals, but with a change in lifestyle and with a change in the nutrition. And the alkaline nutrition at its best upgrades you, and the body takes away your ailments, as it happened to me, and as it is happening to people who are resorting to alkaline nutrition and resorting to nature. Okay, I will tell you a few conditions, a few examples of a few patients I came across in the last few weeks. You can ask me any doubts later on, and I can give an example possibly in my experience. Okay, I have a very wide range of experience in many conditions, and it is mind-boggling. Alkaline nutrition brings you around, and you come out of chemicals. Okay. There was this man who was last month, he had an orthopedic operation in Lagos, in our non-COVID hospital. Now, this man is a Telugu man, and the son is brought him there from India to live with him for a year. The son is there in Lagos for more than 50 years. So he's almost a Nigerian, like, you know. Now, this father is a diabetic. He's on insulin and 2 diabetic drugs. He's a very thin man, and they are Brahmins, but he takes a lot of milk and yogurt. So being the general manager, I see all the patients every day, and I come across this man, and the son was friendly, and I said, for wound healing and to build up the bone calcium, let me give you the alkaline spirulina. I want your father to stop milk and yogurt intake, and of course he's not taking sugar, but he must not take sugar in all forms, and I can reverse his diabetes with that. So they said, sir, he's a diabetic for 30 years or more. What are you saying? I said, I am saying what I am saying. Why don't you try this? So I put him on spirulina and RGGL. He stopped his milk and yogurt. Exactly 2.5 weeks, not even 3 weeks, I got a call from the son. My father is very energetic, the wounds are healing, but doctor, his sugar is falling down now. He's getting hypoglycemic. What should I do? Should I stop the spirulina and the reishi? I said, no, that is just food. They are not chemicals. What is happening is he's coming out of his diabetes. Please reduce his insulin and reduce the metformin and the other drug he was taking. We halved the doses, and within 1 more week, this man was further going into hypoglycemia. I stopped the insulin completely. Over the next 2 or 3 weeks, he stopped his drugs completely, and he came out of his diabetes totally. Now, this is a case that happened last month. Most of the cases take about 6 to 7 months. All you need is to stop negative nutrition and give full-blown positive alkaline nutrition. Okay, and we have in our hands the greatest tools, the most prolific alkaline herb, the most, what shall I say, a herb that normalizes everything in the body with its adaptogen capacity. We have Ganoderma, and just give it to each and every one and they come around. And the same thing with spirulina. It gives us so much energy. The body lethargy goes away, and these herbs and the spirulina, the Ganoderma and the spirulina by themselves correct the lifestyle deficiencies. They make us sleep early and get up early. They make us eat on time if we listen to our body. And by giving them good education, if you eat on time and if you sleep early, get up early, you come out of your lifestyle condition. And this happens to every single lifestyle disease, whether it be gastritis of long years, whether it be esophagitis, whether it be autoimmune conditions, whether it be high blood pressure, whether it be kidney failure. Okay, now I will leave that aside and I will tell you one more so let me just get this. Yeah, one more thing. See, Ganoderma, if taken continuously for 2 years, it has a regenerative capacity, which I'm seeing. Okay, if you stick with it, people come out of kidney failure. People come out of cirrhosis. People come out of organs that have almost more than half of the organ is dead and gone. They come out of it. And whatever is left behind is enough to give them a good and normal life. I can give you so many examples of people on dialysis living 3 times a dialysis, comes down to 2, then once a week. And then you look at them, you don't even tell them that they have, you can't even make out they're in renal failure. This happens in spirulina and Ganoderma. So any disease condition can come around with alkaline nutrition. With this background, I will just give you a basic nutrition chart, which you may have seen already, but just to go through this once again. Vinci, can you put this chart? I just drew it 10 minutes ago. We can just go through it so that we can have with this basic understanding, anybody can come around. This is a handwritten, please bear with me. In the center is the zero nutrition, and the pyramid below is the negative nutrition. I want you to concentrate on the negative nutrition on the pyramid below. At the bottom is refined sugar. Okay, we all are taking sugar these days from childhood. This is actually a killer, and refined sugar is one of the main reasons why we have a reduced world immunity at the moment. Sugar also takes away all the calcium from our bones, and it is actually a bone dissolver. Somebody who has very brittle bones when he is 40 years old, it is because of his sugar intake for 20 or 30 years of his lifetime. If I should not get osteoporosis 10 years from now, I should stop refined sugar. Okay, when sugar is taken, the body immediately within 5 to 10 minutes goes into an acidic balance. Okay, and the kidney for the next 16 hours to 18 hours has to work hard to maintain the pH balance. It borrows calcium from the bone, and literally your bone is going in your urine when you take sugar. Let me say no more. The second point, which is very difficult to understand, but which is the truth, is milk and milk products. Okay, if you stop sugar and milk, you can come around from your acidic balance state in no time. And this, if combined with spirulina and ganoderma, it works wonders for everyone. Somebody who has stopped sugar and milk products alone and is taking spirulina and ganoderma, he goes into an anti-aging state. In no time, he stops aging. Yeah. Just as I said, disease does not exist. Aging also does not exist. I honestly believe that 85 years is basic for everyone, and we can all live up to 120 years if you stop the last two in the negative, in the pyramid bottom, and you take the first two on top, that is of alkaline nutrition. Just put your eyes on top of the pyramid. It's spirulina and ganoderma, and there are a lot of mushroom groups which are so alkaline, and there are so many others also just under spirulina, but I'll come to them one by one. Yeah. Just go back to the negative pyramid again. Above milk is every single chemical drug that we get in the pharmacy makes us acidic. Okay, starting with aspirin, paracetamol, which are top of the list, all the antibiotics, even the vitamins. Okay, we can only mimic nature's vitamins. Whatever we make is not necessary at all, whether it be A, B, C, D, or any vitamin. Resort to nature's foods. Do not take man-made vitamins. They make us acidic. They are just, kidney has to wash them away in the urine. They give you a fake feeling of well-being, but they do not improve the body's alkalinity. Okay. Now, next on top of drugs is negative nutrition is untimely meals. This is so very important. I have so many patients who are cured of esophagitis and gastritis. Reflux esophagitis is very common these days, and people are not cured. And we give a drug called omeprazole or cimetidine or ranitidine to reduce the gastric juice. Gastric juice is one of our first immune system's first weapon is our gastric juice. A pH of 1 to 1.5, which is made from blood, is another miracle that the body is doing. We go and stop it. It makes no sense. If they eat on time and take spirulina and ganoderma, which will normalize the biological flora of the stomach and it gives strength to the stomach lining. That is all that is needed, combined with timely meals. I will just quickly tell you, breakfast at 8, lunch at 12 when the sun is above you, dinner with sunset 6:37, and esophagitis, reflux esophagitis, and most lifestyle diseases start fading away. Coming up above, I shall say no more on untimely meals. Untimely meals should be stopped. There is no point taking lots of spirulina and ganoderma and at the same time having a dinner at 11 p.m. in the night and having no breakfast, having lunch at 3. It is very difficult for the body to make use of the alkaline nutrition that is going in. Okay. Now, all animal products, including fish and fish products, make us. They are not very low down, but make us into an acidic balance. So these are the negative nutrition that we are undergoing in our modern diet these days. Going up to the positive nutrition, all of Earth's products, all fruits and all vegetables. And above that is all superfoods. In South India, moringa leaf is an amazing alkaline superfood. Nellika or gooseberry, then avocado, if you can get it, they are very highly alkaline. And above that comes tonics in alkalinicity. Ginger, garlic, turmeric, ginseng, and many others are tonics which give you a basic alkalinity when you take them. Okay. Intermittent fasting, when we fast once in a while, the body goes into an alkaline state. The body goes into a non-insulin state. Insulin becomes, stops, there is insulin is not being produced anymore, and body starts producing glucagon, where the sugar is produced from our liver deposits and from our fat. And that is the best sugar. When you produce your own sugar, that is your best sugar. That happens during long distance running and when you fast. So we all have to fast once in a while to put us in a non-insulin and into a glucagon state. That is why fasting gives us a lot of immune power, mental power. Look at Mahatma Gandhi. We are independent today because of his fasting power. Okay. Now, Going up above, this is what we have with us, the most alkaline herbs on planet Earth, which is spirulina and ganoderma. Now, spirulina, as we know, is a superfood, way above all other superfoods, because it contains everything that the body needs in a very nutrient-dense form. And it is absorbed right from our mouth. By the time it reaches the stomach, it is water soluble. The body has absorbed it. There is no fat, no cholesterol. Body has absorbed it without any lethargy. And the immediate rise in alkalinity, the immediate rise in the energy gives us, gives the body a boost like no other. And this prevents disease and also reverses any disease that can exist that we know of. When Saji or somebody can ask me questions, every disease I can tell you how these do it. Yeah. And of course, above spirulina for alkalinity, but not for nutrition, but above spirulina for alkalinity and for its pharmacological normalization property is ganoderma, cordyceps, and the other mushroom varieties that we have. Yeah. With this background, I remind you, we have with us spirulina and ganoderma, but it is very important to educate the person who's taking it for the first time that he should stop negative nutrition and have meals on time. It is a very simple thing to do. They say, you know, my work finishes at 9, so I have my dinner at 10. So it is your life. If you want to live more, take your dinner with you. Have your dinner at 6:30, and then you finish your work at 9, come home and sleep at 10. That is how you change your life. Otherwise, you change your job. The job is definitely not more important than your life expectancy and the quality of your life. So these are very important. And if you can go on to a positive nutrition life with spirulina and ganoderma, every single ailment reverses. Okay. And before I stop, I had many patients with arthritis, you know, arthritis brought on by a post-dengue time, you know, during dengue, the dengue virus does not produce arthritis. But what happens is during the dengue, you take a lot of chemicals, antibiotics and paracetamol, and you're bombarded with anti-inflammatories, taking away our GI system's normal flora. The change in flora makes GI to have an inflammatory background, and that inflammatory cells leak into our body and they lodge themselves in the joints. That is why you have arthritis. That this is something, again, there's a huge error of judgment in the world where you go after, you treat the joint for arthritis, but actually the problem is not in the joint, but it is the GI leak because of the inflammatory state and the loss of the normal flora of the GI system. Spirulina and ganoderma, taken over a few weeks, restores our GI flora. They are prebiotics. They restore the normal flora of the stomach and every part of the GI system and stops the leak. Sometimes it might take 6 months, sometimes a year. Once the leak is stopped, the arthritis goes away. But very often, many people have their arthritis controlled with many drugs. For example, if I am taking a bottle of whiskey every day, I cannot stop it overnight. I can slowly reduce it and stop it over 3 to 4 months. So we have to be patient when we give these alkaline superfoods. Tell them to stop those drugs slowly, and they will come out, and the alkaline nutrition and the GI will make the GI system normal, and everybody comes out of arthritis. Not a single person is there who will not come out. But if you resort to chemicals, which is what is happening world over, they will never come out. They are reliant on steroids and all these lifelong till their kidneys fail or their nervous system takes the brunt, or their liver takes the brunt, and it's an organ death that will happen very soon. Yeah. So with these, I shall stop. I can ask for any questions now, and we'll take it on from there. Thank you, Saji. Yes.
Koshy, one question is, nowadays we are exposed to so many toxins through water, air, and everywhere. And I think our body is flooded with a lot of toxins. How we can eliminate this from our body? Because it's creating a lot of issues with respect to many diseases. Can you just tell us something about that?
Thank you very much. Yes, that is why all positive alkaline nutrition by themselves are detoxifying agents. I will tell you, for example, even spirulina is a detoxifying agent. Now, because we are in modern times bombarded with chemicals and toxins from every direction, including our mobile phones. The Wi-Fi is also a toxin. It disturbs our electrochemical balance. So how to correct them? It is with detoxifying agents and antioxidants. Okay, the same thing that results in anti-aging, the same, it is because of the detoxification of the toxins in our body. Okay, the greatest and I think the most powerful antioxidant agent, as far as I know, is Ganoderma. Okay, and detoxifying agent. When you take Ganoderma and spirulina for the first time, for the first few days, you start producing lot of urine, or you have 1 or 2 episodes of diarrhea. This is all detoxification that happens. Okay, it is once the major detoxification happens, then the daily detoxification happens as you take daily. At that time, the urination becomes normal. You have your normal stools. Sometimes your sweat can swell a lot. These are all detoxification signs. Some people go into a detoxification syndrome, or I call it ailment reflection. It is called, they say after 3 weeks, I don't know what is happening. I don't know what to do. There is something happening. They themselves are not able to. It is that ailment reflection when the big detoxification is occurring. As Ganoderma sets in, its work in about 3 weeks time. So all these happen. The answer to your question is to take alkaline superfoods every day of our life. Not just spirulina and Ganoderma. Take moringa leaves at least once in 3 days, not small amounts. The same amount as rice you have for dinner or for lunch, moringa leaves, thorin. Coconut is also a superfood. All Earth's products are detoxifying, alkalizing agents. Okay. Now, take a baseline dose of spirulina, Ganoderma. We have to resort to moringa, nellika, all these in our lives every week at least, if not every day. And we detoxify ourselves every single day.
Okay. Thank you, doctor. It's a nice presentation. Anyone who want to ask question, just raise your hand. We will unmute you. Doctor, I have a question first.
Thank you.
Okay, doctor, for spirulina, we can use for weight loss also and for gain weight also. So how it differs?
Thank you very much. Thank you very much. What a question. Yes. See, first of all, spirulina is not a chemical. Okay, it is just a food, but it is a superfood. The meaning of superfood, another meaning is it does what is best for you. Okay, like a father doing the best for his son. The son will not understand what is going on, but later on he will understand. The superfoods does the best for you. When complete nutrition goes in, the body normalizes itself. Somebody who is thin will put on muscles and will get his all body lethargy will go away. Somebody who is overweight will be normalized with these superfoods. So the answer is every day I'm seeing this. They normalize you and bring you to everybody has his own body language and his own body status. They will bring them in a few months time to their optimal weight, to their optimal strength. Yeah, that is what these superfoods do. Yeah. Thanks, Benjamin.
Thank you, doctor. Doctor, a question from Dr. Satish.
Yes.
Okay, how spirulina and Ganoderma can help in autoimmune disease? Could you please explain about the pathway? Is it helpful for treating the psoriasis, urticaria, and asthma?
100%. Here you are, Benji, yourself. You are yourself
this
a
question
psoriasis.
is from Dr. Satish.
Yes. I will answer. Yes, I think autoimmune diseases are just an immune aberration. Okay, it is actually an immune deficiency brought about by negative immune nutrition. If you look at everybody with autoimmune disease, you can bring it out from their lifestyle. What went wrong? Okay, and if you cannot bring it out, I honestly believe, I will say the truth. I believe the commonest cause of autoimmune disease is the vaccines, which have gone and made our immune system confused. Okay, so immune modulation is what is needed in all autoimmune diseases. The greatest immune modulator, and I have so many examples in my life, is Ganoderma. Ganoderma, we start off slowly along with spirulina to give the body strength, slowly bring down the steroids and all the immune suppressors which are being given for autoimmune diseases now to suppress the symptoms. They do not suppress the disease. All steroids and all chemicals for autoimmune diseases suppress the symptoms, but they do not improve the body or they do not give any immune modulation. The Ganoderma, what Ganoderma does is, within 3 to 6 weeks of taking, the Ganoderma will start its immune modulation work. Okay, in about 6 months to 7 months, you will see any patient with psoriasis or anybody who is on steroids, you can start reducing the steroids and the disease will not worsen. Sometimes it takes 2 years, but you have to patiently take. Once in a while, after the second month, you can take mega doses, or you can even take mega dose for a whole month. By mega dose, what I mean is you can take 10, 10, 10 morning, afternoon, and evening. That is a medium dose. You can go up to 50 spirulina, 50 Rg, 50 GL a day for a month continuously if they're in real trouble, and you will see them all reversing. Yeah, autoimmune diseases and liquid cancers like leukemia, lymphoma very much respond to Ganoderma in mega doses. Yeah, and this is just a food. All you need for autoimmune disease is alkaline nutrition in high doses, and everybody is different. So you will understand as the patient takes the journey, as the person takes the journey, what doses they need. I will just give you a personal experiment I did. Of course, I do not have an autoimmune disease, I thank God. However, I wanted to experiment myself with mega dose. So one of the marathons which I enjoy and run every year was the Auroville Marathon in Pondicherry. So about 7 years ago, I took a week leave and I took mega dose of spirulina, Rg and GL to see what happens to me. So I was staying in a resort in Pondicherry and just taking 50 spirulina, 50 Rg, 50 GL and a bottle of Morinzi every evening. And spirulina, Rg and GL morning, afternoon, evening, and a bottle of Morinzi every evening. And then the coming Sunday, I did the marathon. That was the fastest marathon in my life. I finished it, and there was a lot of students from Bangalore who were all come. I finished with them. I was in the first 50, and I was, I think, the first or second for my age group. And the body is upgraded, the antioxidants, and the when you come down by 18 minutes, and this is, I've got the certificates, I show them in my talks always. To come down by 1 or 2 minutes when you're running regularly is a big thing, but to come down by 18 minutes, something miraculous has happened to your body. This, if it can bring down my marathon time by 18 minutes when I am at that time 52 years old, then the same thing can take away autoimmune disease. Yeah.
Okay. Okay, doctor, thank you. Doctor, the next question is, DXN product support in avascular necrosis.
I didn't hear you. What necrosis? Avascular necrosis.
Yes, sir. Yes, doctor.
Definitely. See, what does Ganoderma do? See, both Ganoderma and spirulina, they improve the microcirculation of the body. Okay, that is how you get more oxygen into the body. Ganoderma over the time brings down blood pressure. It has no antihypertensive chemical in it, but it improves microcirculation. That is how your memory improves. Your eyesight improves. My running time improved because the oxygen was received by every cell in my body. Okay, people who have erectile dysfunction, they improve. So the microcirculation is improved. We have chemicals to improve. We have chemicals in blood pressure treatment where chemically we improve where the vessels are opened up. But they have a big toll on the kidney. They make our kidney fail. Here we have Ganoderma, which improves microcirculation and at the same time regenerate our kidney cells, and kidneys are all celebrating. So definitely it has a big role in avascular necrosis. Yeah, provided the necrosis is not complete, it will revive. Yes, but you must take it for some time. It takes about 3 weeks and about 6 weeks to 2 months for us to get the full benefit of the Ganoderma. It is not a digital chemical. It takes time. It is just a food. But the microcirculation improvement is what was shown in my run. It is what brings down the BP when people have all their microcirculation closed and that they go into a hypertensive situation. This improves the microcirculation. Yes.
Thank you, doctor. The next question is how Ganoderma helps in prostrate patients.
Thank you very much. See, I will tell you, I have so many examples. Just like prostate, an equivalent is uterine fibroid. Okay, both in prostate and uterine fibroid, they are actually an aberration that has happened. When you have nodules in the prostate, when you have nodules in your uterus, they are an aberration caused by an acidic background. Okay, and there are two things. Since the question is on prostate, I will stick to the prostate. Prostate, there are two main reasons. When you do not exercise and you're sitting on the prostate all the time, there is no venous outflow. Okay, we are sitting on our prostate. Right now, all of us are sitting on our prostate. If we have not gone for a run in the morning, the prostate is so unhappy. There is no microcirculation there. You understand? So, with this, along with an acidic imbalance, makes us produce prostatic nodules. Okay. What Ganoderma does is, Ganoderma, with its immune modulation and its adaptogen capacity, it goes and reminds the prostate cells that this is not what you should be doing. You should be going back to your normal size. Prostate starts shrinking in a few months' time of taking Ganoderma, provided the patient also exercises and takes away the negative nutrition. You take Ganoderma alone and you continue to sit all day. Say if I'm a bank manager, I'm sitting all the time. I have to make an effort to have a run in the morning or run in the evening, or every half an hour go for a break, walk around. Then Ganoderma has a fantastic effect on the prostate. Prostate starts coming down. Your PSA levels by themselves starts coming down. Yeah, I've seen it in my life in so many people. So does uterine fibroids. They start shrinking. They start shrinking too. Yeah.
Thank you, doctor. The next question is, can we give spirulina to renal dialysis patient?
Thank you very much. This is a question that is asked because spirulina is a protein and you don't want to overload the kidney with protein. But I will tell you something, we need protein to live. Even a patient on dialysis needs some protein to live. Okay, so that protein, let it be spirulina, because it is the purest protein in the world. It is water soluble. So whatever protein it takes, again, I will tell you, I had a patient who came to see me when I was in Cochin last week, and she's on dialysis, but doing well now. We just started on spirulina Ganoderma now. It's only 2 months now. But already the big change is coming on her because the anemia has come off. She has no anemia now, but she was advised by the doctors in Cochin not to take any vegetable protein, but to take chicken and fish as a protein, and then to take, she's also on statin drugs and 4 antihypertensive drugs. So that is how now all of you are listening to me. You have understood what is wrong with the food that has been given to her. She has been asked to take chicken and fish in small amounts to get her protein, and then she's also an atorvastatin to reduce her cholesterol. It doesn't make any sense. So I said, you stop your chicken and fish, get your protein from spirulina. So don't overload whatever protein she needs, which will be basically 2 morning and 2 evening on non-dialysis days. If you give it on the dialysis day, it will just get washed away. So just give that and stop chicken and fish and stop any statin drugs. All that will overload the kidney for no purpose at all. She was on about 15 drugs and half of them were absolutely not needed. So that is how the world is going now. So the answer is spirulina is the best form of protein you can give in dialysis patients. Their anemia resolves because anemia, there is nothing like chlorophyll, and spirulina has chlorophyll and iron, and there is nothing like that to correct the anemia. All patients on dialysis will have a HB of 7 or 8 only, and they will have a blood transfusion once in 2 or 3 months. People on spirulina and on dialysis will not need a blood transfusion. Their HB will be 12 or above. Yeah. This happened to that lady. This happened to so many patients of mine. Unfortunately, the doctors treating for dialysis, they don't want to know why is this HB high? Why does this patient not need blood transfusion? There is no question. If somebody opens, they will also learn and know a better way, and the patients can come out of dialysis. Yeah. So I think I've answered your question there. Yeah.
Thank you, doctor. The next question is, how long it will take to reduce pigmentation on face in women?
I don't know. I don't know. Pigmentation of the face is 90% of the time it is accumulation of toxins in the body. Okay, especially people who have gone to the Gulf, to the Middle East, from a South Indian sort of environment and live in that environment. You see this pigmentation on the sides of the cheeks. Yeah, detoxification will cure it, but it takes a long time. Yeah, no amount of laser, no amount of creams will cure it. You have to detoxify the body, and the body has to become alkaline, and the pigmentation fades away. Even if the pigmentation does not fade away, it will not be prominent when you are on spirulina and ganoderma. So the timing will differ, and whether it will go completely also depends on the patient. Yeah, how long it will take depends on, everybody is different. But ganoderma is the answer. Intake of ganoderma and stopping negative nutrition in their lives. Yeah.
Okay, doctor. The next question is, are there anything somewhat equivalent to this Indian Ayurvedic?
Thank you very much. Yeah. Yeah. Thank you for that question. To be honest with you, the answer is yes. The answer is yes. But this is a one-stop solution. There are, my interest in Indian Ayurvedics has taken me across so many things, and they are amazing. Once you stop negative nutrition and you give Ayurveda, things are amazing. But even the Ayurvedic doctors have closed minds, you know. Yeah, they don't open up their minds. Yeah. There are so many things in Indian Ayurveda. Yes, the answer is yes. But if you combine that with ganoderma and spirulina, it is beyond combine. It is, miracles start happening. Miracles are happening, and I've started doing them actually. Yeah.
Thank you, doctor. Doctor, the next question is, could you suggest some of the Indian alkaline food?
Thank you. Thank you. I think the best Indian alkaline food for our current times and for always is moringa leaf. Moringa leaf is so very, very alkaline, and it has the power of spirulina. If you have spirulina and moringa leaf, you get your youth back, believe me, but not in small amounts. Okay, you must take the same amount of moringa leaf as the rice you take. Okay, combine it, make a torrent if you want, with some coconut on top. It is amazing. Yeah, it is a superfood which we have in every corner of South India. The second one is Nellikya. Nellikya is super dense. It has so much iron and so much vitamin C. In one way, Nellikya beats spirulina for its vitamin C content. Spirulina has everything. Vitamin C does not exist in spirulina, and vitamin B12 exists, but whether it is in the active form is questionable in spirulina. Yeah, but Nellikya has vitamin C in so much quantity, and iron in so much quantity in a water-soluble form. So Nellikya is a superfood that we should all be taking, and if it is combined with spirulina, miracles will start happening in your life. Spirulina and Nellikya, yeah. And it is best to take Nellikya raw, eat it raw. But when we pickle it, we are actually taking away. We are sort of, you know, taking away its power. And when we are boiling it also, so you have just clean it and have it raw, or put in a mixie. Yeah, combine it with some curry leaves and make a chutney or something. And Nellikya is amazing. What we have. Yeah. Yeah.
Thank you, doctor.
Yeah.
The next question is, do all these superfoods help MS patient for their well-being, and how long do I need to consume these superfoods?
Yeah, the MS is again, I believe from the MS patients that I see that they all have a problem with animal products. Okay, with animal products, meat products. It's my personal experience. Yeah, so definitely they must stop animal products. And I also believe that again vaccines have a role to play here. People will say, where is the evidence and all that? See, there are so many things that comes out of experience, and you cannot produce a paper on these things. It is just not possible. Just look at it. How can you say what caused the MS? You just cannot say anything. And when the whole world is taking a polio vaccine, you can't get a cohort of 1,000 or 10,000 people who have not taken the polio vaccine to say that they never developed MS. So then you can never have a paper. Yeah, but I do believe so. Yeah. An MS patient, if the patient stops negative nutrition and takes mega doses of spirulina, ganoderma, and superfoods, they will all improve. Some will take time, but they will get the taste of their tongue back. They will start moving better. Their proximal weakness will get better. Sometimes it takes a year, but they will all get better. Sometimes as early as 2 months. Yeah, but you must give in large doses right from the start. First few days, they will have diarrhea, they will have problems as they detoxify and they change and as they alkalinize, but they all improve. They all improve. Yes.
Thank you, doctor. The next question is, what about depression cases?
Thank you very much. The depression is lifestyle induced, chemical induced. The answer is ganoderma, and it is the adenosine in the ganoderma that gives the intracellular delivery of ganoderma and positivity. Positivity comes to anybody who's on ganoderma, and since adenosine gives us the delivery, adenosine is maximum in our linseed coffee. Just have ganoderma, RGGL, and linseed coffee. In a week's time, your depression goes away. To anyone, depression goes away. You start getting positive. Your negative thoughts do not come into your mind. Yeah, ganoderma is the answer for depression. And in fact, in the Western world, if people understand this, lot of suicides and depression can be averted. Yeah, this ganoderma is the answer, especially our linseed coffee. Yeah.
Super. Thank you, doctor. The next question is, can you explain detox syndrome with your patient? Sometimes patient got embraced with numbers in report.
Embraced with? I did not hear you.
Numbers, the ratios.
Ah, okay. Yeah, actually, the number is 100%. Everybody goes through an ailment reflection. That is, there is no chemical in spirulina or ganoderma. Okay, but the body responds to the alkalinization, and in every single person who takes this will have an ailment reflection. Okay, now it could be with smelly sweat, it could be with increased urination. But people who have allergies, the allergy will actually worsen immediately. The itching may worsen, the redness may worsen, and then, so it is very important that you tell the person, educate him. You will have a worsening of the symptom. You may have, but you will definitely have increased urination. Just drink plenty of water. You may have 1 or 2 episodes of diarrhea. They are all detoxification or an ailment reflection that is happening as your body is switching into a healthier alkaline mode. Okay, some people may even have acidic tantrums. You understand? Yeah, they will come very disturbed, and they will come and tell you, doctor, I don't know what you have given to me. There is something in it. So you have to just calmly they have to go through it, and then they will come back after a month's time. I will tell you something. Okay, everybody who is acidic also has an acidic mind. Okay, only an alkaline body can embrace within itself an alkaline mind. An alkaline mind is a calm mind. It's an inclusive mind. For him, there is nothing called Indians or Pakistani. Everybody is the same. And he sees, he has an inclusion. As you go more and more alkaline, once you are inclusive of everything around you, Okay, it will go on to animals, and you will stop finding fault with anything. All that happens in an alkaline mind. When a person goes through an ailment reflection, and in a month's time, if you notice carefully, you can see his personality changing. A very doubting or angry man, they will come and you will find him changing. Their whole family life, their whole body, the mind changes. All these happen. So the ailment reflection happens to everyone, but in different forms and in different stages. Some people don't recognize it, but if you look for it, you will find it. Yeah, so it's very mild in most, but it can be very troublesome in a few. They have to just go through it. You can even stop for a few days, drink plenty of water, and go back to restart again after that. Yeah.
Thank you, doctor.
Question, one question. This
Gallbladder
ailment
removal patient having pain, what will be the dose should increase?
Okay, okay, carry on, carry on.
Saji, I did not hear the question.
1 minute.
Okay, doctor, can I repeat?
Ailment reflection, how long it is going to be for people? Because it varies from person to person, I think.
Thank you very much. Yeah, the ailment reflection in some people who are on multiple drugs can go on for some time. Can go on for time. For example, if I am I'm a diabetic, I'm on 3 drugs, and then I'm also a hypertensive. So every time I take the alkaline nutrition, again my drugs are making me acidic. So the ailment reflection will peak and will go on for some time. So I have to be educated. I have to be told, this is nothing to worry. This is something that, as the body is upgrading, and as this goes on, we can slowly start reducing your acidic input and your symptoms will normalize. But however, in majority of the cases, it occurs about a week to 10 days after starting, and it goes away in a few days time. In 3 or 4 days time, it goes away. It goes away in majority of the cases.
Thank you, doctor. Doctor, the next question is, can we give spirulina ganoderma to a liver transplant patient?
Thank you very much. It is actually, you know, all transplant patients, they need immunosuppression. So it is against the Earth's rule that we are going. So spirulina and ganoderma improve our immunity and thus may cause immune rejection of the transplanted liver or kidney. However, if given in small doses, just to keep their health upgrade, that is 2 spirulina, 1 Rg, 1 GL a day, I find them living a healthy life. It's not big enough to produce a huge immune competence. At the same time, they will be on immune suppressants, but this small dose is best to give them a very good feeling of well-being, and they have some strength in their body. So I would suggest to give them 2 spirulina, 1 Rg, 1 GL every day, and that will be okay, but not more, Yeah.
Thank you, doctor. The next question is, dose of spirulina and ganoderma for cirrhosis and kidney diseases cases. And the second followed question is, can these given to pregnant ladies?
Thank you very much. The first question, cirrhosis and ganoderma. See, I'm telling you, cirrhosis can totally reverse in time with ganoderma. Okay, yeah, I suggest if he's an alcoholic, definitely he has to stop his alcoholism. The cirrhosis may be from some medications. All that has to be weaned off and stopped. Okay, and then ganoderma takes over. But for both for kidney disease and for cirrhosis, at least once a month for 3 days, you give mega dose. That is 10 spirulina, 10 Rg, 10 GL, morning, afternoon, and evening. Just bombard it, and that will start the regeneration process in both these organs. Okay. Otherwise, start off with a baseline dose of 2 spirulina, 2 Rg, 2 GL. After a week, make it morning and evening. And then after a month, give 2 spirulina, 2 Rg, 2 GL morning and evening. And then mega dose once in a month for 3 days. And then as they improve, you can keep increasing the dose. Everybody is different. You can see how they are responding. If they are still weak, you can go up to 4 spirulina, 4 Rg, 4 GL morning and evening with mega dose once in a while. Yeah.
Thank you, doctor. Can these given to pregnant ladies?
100% you must give spirulina and Ganoderma to pregnant ladies. This is the best thing they can do for themselves and for their baby. Okay, in pregnant ladies nowadays, because of, as Dr. Saji said, we are having chemical toxins induced from everywhere, and so is the pregnant person, especially if she's in Delhi or in Mumbai. There is so much pollution all around you. So around the 6th or 7th month, there is a common condition now coming called sudden liver necrosis in pregnancy. The liver just starts like cirrhosis. It is because the liver is unable to detoxify during pregnancy with the toxins that is happening. So the answer is spirulina ganoderma here. Keep your body detoxified, keep your body strong, and this is actually in current times, it should be given to every pregnant person. And it is better to give spirulina than to give man-made folic acid and man-made iron when you have the original forms here, Earth's iron and chlorophyll in the spirulina. It's the best thing that you can give. Yeah. So it should be given to all pregnant ladies, if you ask me.
Thank you, doctor. Thank you for your patience. 3 more questions having doctor.
Yes.
Yes. What is the average dose of RGGL for a normal person should consume?
Yes. Thank you very much. I would say 2 RG, 2 GL morning and 2 RG, 2 GL in the evening. I would also suggest give the alkalinity to the body first thing in the morning. As soon as you wake up, even before brushing your teeth, you wash down with 2 RG, 2 GL, and the body will be so happy. All of us, we go and have a milk tea. That is the Kerala or South Indian this thing. You are taking you are giving the body the acidity in the milk first thing in the morning. Yeah, instead take RG and GL in the morning and evening before dinner. So every 12 hours you take and you have the ganoderma in your body. That is what I would suggest. Yeah, but it differs and it's up to every individual. You can take more or you can take less. There is no problem. Yeah.
Thank you, doctor. The next question is, metastasis is happening in cancer patient and ganoderma is doing apoptosis. Can you explain, sir?
Yes, see, I will tell you, when somebody gets it's in a cancerous stage and there is metastasis, you can see a cancerous change cannot occur in an alkaline, well-oxygenated cell. It is as simple as that. But then again, when you have got a cancerous aberration, it is because of the acidic imbalance and the hypoxia over at least 1 or 2 decades, maybe over 20 years. Okay. And when something is metastasizing, it means more and more cells are going in if possible, to reverse the whole thing. So you have to resort to mega doses. Yeah. And as I told you in my nutrition chart, if people understand and take only positive nutrition, give up all negative nutrition, and also resort to fasting. If they can fast, if they have the strength, fast even 2 times a week. But during fasting days, take mega doses spirulina ganoderma. It works wonders. You fast all day, but have about 5 or 6 Lindsay coffees, have 50 RG, 50 GL, 50 spirulina. It works wonders. It works wonders. Yeah. I believe there are people in Indonesia who give mega doses for 1 or 2 months every day in these conditions, and many come around. Yeah.
Thank you, doctor. Okay. The next question is, gallbladder removal patient having pain, what will be the dose should increase?
Yeah, when somebody has pain after removing gallbladder, look for stones in the rest of the bile duct, the common bile duct, rule out. Yeah. Spirulina ganoderma can be given in the normal doses, 2 morning and 2 evening. They will actually prevent or help in prevention of more stones which have an acidic balance to it. Yeah, but gallstones have many other possibilities also. High fat intake. Sometimes you can have an inborn error of metabolism. All those ganoderma cannot help, but definitely one can take 2 morning and 2 evening. Yeah.
Thank you, doctor.
Yeah.
The next question is, 10 to 30 spirulina per day, any chance of constipation in a patient with piles and constipation already?
Yeah. In a patient with piles and constipation already, don't take 10 to 30 spirulina. No, because you need, with spirulina, it is so, the solvent is water. So you need lots of water for its absorption. Otherwise, it goes unabsorbed. That is why when you take mega doses, if you don't take enough water, you have to take a lot of water when you take so much spirulina. Otherwise, it just goes away as green stools, which is spirulina that was unable to be absorbed because of lack of water. Yeah, so don't take so much when you have piles. Yeah, all piles of grade 1 and grade 2 reverses, because piles is a body lethargy. It is because of the weakness. The piles have just, the lower part of the anal canal is just coming down. It is a weakness. There is no point in operating because the weakness still remains. But you give it strength with spirulina and the Ganoderma alkalinization of the normal flora. Piles of grade 1 and grade 2 just resolves. They just have to take it patiently. Yeah. So I think about 4 to 6 spirulina a day will do with lots of water. Will do. Yeah.
Okay, doctor. Thank you. The next question is, what is the dosage of Ganoderma and spirulina for prostate if there is no result in 6 pairs?
There is no result in 6 bath for
6
piles.
pairs. 6 pairs.
Oh, 6 pairs. Yeah. See, how do you judge that there is no result? Is it from the PSA or is it from the ultrasound, or what is it? I will tell you. I think they may have taken the ultrasound scan and looked for the size of the prostate when you say there's no result. Yeah. See, I'll tell you something. Okay. The first thing that happens with Ganoderma is whatever disease process is going on, it stops expanding. Okay. A prostate that is keeping on enlarging will stop enlarging. A uterine fibroid will become asymptomatic. It may remain the same size for a year, but it will become asymptomatic. It will stop growing. And then it starts regressing. Yeah. With six pairs, you can go up to even 10 pairs, 12 pairs, or once in a while take a mega dose. Once in 3 weeks, one weekend, take 30 to 40 a day. Yeah, but definitely when you do an ultrasound scan, after a year or so, you will find the prostate shrinking. Yes, provided patient has to exercise in prostate, because sitting all the time, very difficult for the microcirculation. Whatever Ganoderma does, we have to aerate, we have to walk around, we'll do some running. Otherwise, the prostate does not get its normal exercise there. Yeah. So, yeah, that is the answer. Yeah.
Thank you, doctor. Thank you very much. What is the dosage for a person who has cured from blood cancer? Presently, she is low in immunity.
Yes, it depends. It depends again. I would suggest start with 2 morning and evening, 2 spirulina, 2 RG, 2 GL morning and evening. After 3 weeks, go to 4 morning and evening. Yeah. So once she is alkalinized, go to 4 morning and evening, lifelong. They will have life extension at least 20 years. At least 20 years. I have no doubt. Yeah.
Sure, doctor. Thank you. The last and final question, doctor. What is the dosage of spirulina for kids?
Yes. See, when you ask dosage, this is just a food. So how much rice do you give? So it is all up to you. So I would suggest for somebody in first 1 year of age, give 1 tablet a day. 1 tablet a day. Up to 5 years, 2 tablets a day. After that, you can give 3. And as they grow up into 5th standard, 6th standard, you can give 4 a day, 5 a day. And as they start sports, you can give even more. Yeah. And school-going kids, you can give with breakfast and then again in dinner. But baseline of 2 in the morning and 2 in the evening would be ideal once you are above 7 years or so. Yeah.
Thank you. Thank you very much, doctor. So it's a nice session. We have a highly informative knowledge with you, doctor. Thank you very much. in your busy schedule, you are being here for only 10 to 15 days in this time. You have given a right time for us to take a very good information about Ganoderma and spirulina. Thank you very much, doctor.
In March, during the first lockdown time, and initially 2 weeks or 2 weeks or so, I also had severe ailment reflection. I was really about to stop it. But after a week, all the things got changed. I feel more energetic. I think I was undergoing some kind of detoxification. So afterwards, everything got changed. I feel more energetic. And during the last 8 months, I have suggested to do more than 100 people. And the results are very, very amazing. From the age of 20 to 85, I have suggested, and all are giving very good appreciation about the products you mentioned. So thank you very much, Dr. Koshy. We will continue to be in touch with you. And I think more and more patients will come to us. Definitely, we will transfer their requirement to you. Thank you very much.
Thank you, sir. Thank you. Thank you, everybody. Thank you.